Hi, I'm Tom Duszynski. I'm a faculty member in the Department of Epidemiology, as well as the Masters of Public Health Program Director at the Richard M. Fairbanks School of Public Health at Indiana University, Indianapolis. And I want to welcome you to the Masters of Public Health program here at the Fairbanks School of Public Health. I want to sort of explain to you what makes our MPH program unique or excellent. And I think there are four things. It's the curriculum, the opportunities, the people, and the place. So let's talk a little bit about each one of these. The curriculum. We have lots of opportunities here in terms of what you can learn and sort of the different tracks you can go down. Everybody comes in starting as interdisciplinary. You may not know all the facets of a Master's of Public Health and all the concentrations and coursework that you can do. So we're going to give you some introductory classes as an interdisciplinary student that allows you to sort of pick and choose what it is you want to study. Some of you may want to remain as interdisciplinary students, which means then you get to kind of pick and choose your courses as you go, things that are of interest as well as that will help your career down the road. Others of you may want to concentrate in a certain area like epidemiology or health policy and management, informatics, or social and behavioral sciences, which you can do at our school as well. So the curriculum itself is 6 core classes. These are those introductory classes as an interdisciplinary student you will take. They cover things like social and behavioral sciences, introduction to epidemiology, introduction to health policy and management, informatics, environmental health, intro to public health itself, right? So you get to sort of dip your toes in the water of all these different disciplines before you commit to anything. If you decide to do a concentration like epidemiology or health policy and management, social and behavioral sciences, informatics, you have 4 concentration courses specifically in that field, right, which accounts for 12 credit hours. You also get to choose 3 electives, or for 9 credit hours. Now, the flexibility here is that you could choose electives in any of the other disciplines, right? So for example, if you were an epidemiology student, concentrating in the field of epidemiology, but you want to take a class in social and behavioral sciences, maybe around maternal and child health, you could certainly do that, right? That we're allowing for that flexibility for students to gain the knowledge that they think is going to help their career and that they find interesting. We also require you to do an internship, which is 2 credit hours. We have lots of opportunities, lots of agencies that approach us looking for interns, as well as giving you the sort of that practical in-field experience. You will also be able to sit for the Certified in Public Health course and exam, which is going to give you an additional credential upon graduation, and then you complete a capstone project here at the school. Second part that I think makes us unique is the opportunities, right? We have lots of different things that you can get engaged in. So for example, as a student, you're either going to be an in-person sort of hybrid or an online student. The in-person hybrid is that at least 50% of your classes or more are going to actually be in person on campus. The other classes then would be online. Right. We also have 100% asynchronous online Masters of Public Health program, which offers a lot of flexibility as well. We offer study abroad programs to our master's students with more of those opportunities coming. So for example, we've gone to London, we've gone to Geneva, we've gone to Norway, we've gone to Israel in the past. We're looking for additional opportunities to sort of take students to different parts of the globe to engage in public health activities there, or at least understand the differences between public health in these countries. There are plenty of student organizations here on campus as well that we really encourage a lot of our graduate students to get involved in, right? Whether that's student government or other organizations here on campus or even off campus. We offer a tremendous career development section. Our Office of Student Success is extremely well versed on internships, on building resumes, mock interviews, those things that you need to be successful upon graduation, and including the Public Health Core. So the Public Health Core was developed to allow other agencies outside of the school to contact us and say they need help, right? Sometimes this is an emergent situation like a foodborne illness outbreak where they can call students and ask them to do interviews. Sometimes it's providing administrative assistance around like a flu shot clinic or a COVID-19 shot clinic, right? Those sort of big clinic settings as well. All of these things are opportunities where you as a student can get engaged in public health through our school. Other opportunities within our school, we just launched not too long ago the Eli Lilly Enhanced Epidemiological Fellowship, where we select 2 students to have mentors at Eli Lilly if they're interested in the pharmaceutical industry. We have an FSPH graduate scholarship, study abroad scholarships, Outrun the Sun scholarships, which is associated with skin cancers, Care Institute Group Scholarship, and the 10th Anniversary Scholarship. So there are opportunities for outside financial funding as well. Another factor are the people, right? Many of our faculty have worked in public health before coming to the Fairbanks School of Public Health. So we have people that have worked in the field in various levels, various agencies that bring that knowledge, that experience into the classroom so that we can have discussions around more than just theory and applications. We have staff that are dedicated to student success. All of our faculty, all of our staff want to engage with students. I mean, that's what we do as a university. That's what we do as a school is we teach and we want to engage. We want to build the next generation of public health professionals here in this country and abroad. I think our students are unique as well. We have a very large, diverse student body on this campus, and they bring a lot of those real world experiences into the classroom, and we get to share those experiences, which really enriches and enhances the learning experience. So we have the science, we have practice, we have this ability to make a difference, right, in the science of public health. And then the place. It's basically at the center of it all. We are in the city of Indianapolis, which is not only the largest city in the state of Indiana, but it's the capital city, which means then we also have 5 major hospital systems here within our campus area. We have the Indiana Department of Health, so the state health department. We have the largest county health department in Marion County. We have the Regenstrief Institute, which is the largest health information exchange, and a comprehensive cancer center, all on this campus, right? And we have connections to all of these agencies that we've talked about. So building that rapport, we have connections already, right? If you want to get engaged in one of these areas, in one of these fields, in one of these businesses, we have connections to help you do so. Where are our graduate students working? I'm not going to read all of these, but you can see over there on the left where, like IU Health, Department of Health, Family and Social Services Administration, lots of local health departments, lots of hospitals, schools of medicine. Some of their job titles include surveillance and case management supervisor, study director, injury epidemiologist, microbiologist, epidemiologists, safety coordinators, and the list goes on, right? So there are, again, a lot of opportunities for you to get engaged in any of these fields. We just need you, right? And you do belong here. As public health as a discipline embodies diversity, equity, inclusion, as well as social justice principles, right? Public health is founded on social justice. Differences in opinion, background, and perspective provide an opportunity for all of us to learn and grow. We promote a welcoming and inclusive learning environment, and diversity in its many manifestations are celebrated, and different points of view can be expressed, respected, and valued on this campus and within our school. If you have any questions, please reach out and ask, and we welcome you to the program.